Just as the world opened fire on COVID-19, the virus starts taking on a new face.
The novel coronavirus has mutated in a way that affects its spike protein.
At least 2 variants of the coronavirus suddenly appeared in Britain and South Africa, a potentially more infectious mutation, though not necessarily more serious or more deadly. Researchers are paying close attention to it. Countries where the new variant is spreading, shutting their borders.
Minabuti na ng IATF na magdoble ingat at magrekomenda ng temporary travel restrictions.
For now, foreign travelers from 20 countries are not allowed in the Philippines.
We may or may not have, but so far we don't have evidence.
Amid a vaccine controversy and with mass immunization plans still unclear, the world enters another phase of the 21st century pandemic. A new battle at the start of a brand new year. I'm Pia Hontiveros. We'll be asking the hard questions for stories that matter to you. Front and center is the changing face of COVID-19, the science behind SARS-CoV-2 mutations, and what it means in global efforts against the pandemic. How the country is preparing for the new variants and responding to the new challenges, and how we can help bring this pandemic to a timely end. Now, as the world attempts to develop immunity against COVID-19, the virus starts evolving. In 2 independent but coincidental events, SARS-CoV-2 mutates into what seems to be more contagious forms, one in the United Kingdom and another in South Africa. Front and center in understanding these changes is the Philippine Society for Microbiology and Infectious Diseases, Dr. Marisa Alejandria, the PSMID's president, also leading the country, the World Health Organization Solidarity Trial, and also joining us is infectious disease expert Dr. Rona Bergantin. Doctors Alejandria and Bergantin, thank you very much for being with us on the show on Front and Center. This is like opening another front in the battle, right? Are we already battle weary, or should we just set that aside and just stay focused? Dr. Alejandria, you first po.
I understand that, yes, we are all suffering some form of pandemic fatigue, no, I would say. But then we need to keep our focus in controlling this virus, no, this SARS-CoV-2. Because as you've seen, we know there are data, no, that we know already about the disease, about COVID-19, about the virus, but it continues to evolve. And one of this is these variants that have been identified in South Africa and UK. No? So this means that we cannot yet put our guard down with regards to preventing the transmission of the virus. So we still have to keep our focus and strengthen our preventive measures against this virus.
Dr. Bergantin, what do you think?
Definitely, I will agree with Dr. Alejandria that even if we are suffering from somewhat this fatigue in treating and dealing with our patients, we always have to maintain our equanimity. We should always focus so that we can serve better. And we can do better in dealing with patients who have this kinds of illnesses. And definitely, as frontliners, we should always stay put and always know that even if we are battling such an illness, somehow we are of a bit, let's say, I'm saying that we are a bit somehow more in an advantage because we have been dealing with this pandemic for almost 9 months. So we have learned some lessons that we can already apply.
Well, before going any further, Dr. Alejandria and Dr. Bergantin, CNN's Dr. Sanjay Gupta has a really good explainer. Let's listen in first.
The novel coronavirus has mutated in a way that affects its spike protein. We have genetic material, DNA, in all of our cells. As cells multiply and DNA gets copied, mistakes get made. In fact, your DNA mutates all the time and you almost never notice. But sometimes those changes do matter.
So, ma'am, Dr. Alejandria and Dr. Bergantin, we do know now that it is more transmissible, but it is not deadlier. And is that something that we can rely on, that we know for sure?
With regards to the virus not being deadlier or not causing more severe disease, that is what we are seeing now, no? But we still have to monitor the behavior of this new variant. No? So far, what we know is that it is more transmissible than the original COVID virus, no, COVID-19 virus. This variant is more transmissible, but not as deadly or not causing a more severe disease. Yes, we can believe that, but we still also have to continue to monitor the cases, no, that we are seeing, and we need to see how it is evolving also in other countries, no, where the variant has been identified. And here in the Philippines, we are also having initiatives, no, to sequence the isolates, no, from travelers coming from countries where the variant has been identified. So those travelers with a positive PCR, their specimens or isolates will also be sequenced by the Philippine Genome Center to identify, to determine whether the variant has already entered our country or it has been existing in our country. So we're also going back, looking, the Philippine Genome Center will also analyze specimens among patients who were hospitalized in November and December to see if this variant has been in our country already, even before.
We'll talk more about that in a bit, Dr. Alejandria. But Dr. Bergantin, this question first for you. So already pinag-usapan na yung UK and South Africa variants, and we're looking at the maps right now. Can we safely say that there will be more variants that will emerge as time passes?
Definitely yes. Because viruses mutate once in a while. They say that with this COVID-19 or this SARS-CoV-2, it takes at least 2 weeks for mutations to occur. So considering that the pandemic has been present since March and the virus has been present since December last year, so we can only just estimate that there have been multiple mutations, but only these new variants are being seen right now or being focused on simply because there are more people who get sick with this kind of variant. And with what you have mentioned earlier on, that there is definitely higher risk of transmission, but there are no proofs that there will be more severe illness. What is saddening about this fact that there is increased transmissibility is also the increased possibility of people getting sick. So if our hospitals will be inundated with all these patients, our capacity to treat these patients will also suffer somehow.
Yeah.
And that is why you're giving all these warnings ngayon pa lang. Also, the U.S. Food and Drug Administration, FDA, Dr. Paul Offit was saying, and we quote, "We need to really pay attention to this. The UK variant and South African variants are warning shots. It's contagious in the same manner that the non-variant strain is, which is to say it's spread by small droplets, so masking and social distancing still works. But were this to mutate away from the vaccine, that would be a problem." So that's from the US FDA, a statement from them. My two questions about this, Doctora Alejandria, you first. Mutate away from the vaccine. So that doesn't sound so comforting, because at the moment, what we're trying to do is purchase and secure all these vaccine supply that all these pharmaceutical firms have been coming up with. And there's a mad scramble all around the world to get this supply. And then you have this, these concerns, these worries that this might mutate away from the vaccine. What does that mean scientifically? And what does that mean? How does that impact on our battle against this pandemic?
Okay. So currently, there is, as we mentioned, there is no evidence to suggest that the variant has any impact on severity of the disease or efficacy of the vaccine. No? So, uh, the vaccines right now target several parts of the virus protein. So we do not expect, that at this time that the vaccines will not work. It will take several mutations for the vaccine to really not work. So this will entail really monitoring the behavior of the virus and also monitoring the outcomes among those who have received the vaccine. So those are two things, no? We have to monitor the behavior of the virus and then to monitor also those who have received the vaccine. And as I've said, we do not expect, it's not expected at this time that the vaccine will not work. And in case that will arise, over time, then that is the time that the scientists can tweak the structure of the vaccine to address whatever strain or variant will become dominant over time. So that takes a long time to
All right.
happen.
And my second question, Dr. Bergantin, please respond to this. Again, a little bit worrisome when Dr. Offit of the US FDA says these variants are quote-unquote warning shots. Warning shots, parang gera talaga. Very apt description because this is the life-defining moment for our generation in the same way that the Second World War, a real war, was the life-defining moment for our parents or our grandparents' generation. Nakakabahala ba talaga ito pag sinabihan tayo na these are warning shots?
I think that should that should signal us to be more on our toes so that we will be more on guard. Definitely, we have to continue with our practices of social distancing, donning on the face mask and then face shield, and then observing, of course, other means to protect ourselves, like the appropriate ventilation. We're going to take a look at it. Definitely, these are warning signs, warning shots, because as I have mentioned, the virus can really mutate. Similar with the influenza, year in and year out, we get vaccines simply because these viruses do not go away and they just stay there. They mutate, so they infect individuals at any given time.
If I may add,
Doctors Alejandria and Bergantin will... Oh, sorry. Go ahead.
yeah. If I may add, mutation is a form of survival. So our viruses are expected to mutate. It's one way of surviving in the human body. And one way to prevent mutations if we are going to keep the infections low. So if we can decrease the burden of infection, then less mutations can occur. And how do we decrease the rate of infections, as mentioned by Dr. Bergantin? We again have to we have to strengthen our precautionary measures, our minimum public health standards, wearing of face mask consistently and properly, together with the face shield, and then appropriate avoiding crowds and enclosed spaces where these viruses can be transmitted. We'd like also to say that the mode of transmission remains the same, as of now, with these variants, regardless of the mutation, the mode of transmission remains the same and the precautionary measures remain the same.
Doctors Alejandria and Bergantin, you will both join us again later on in the program to answer a few more questions from me and to answer a few more questions from viewers and netizens about these new COVID variants. The stories that matter are front and center, restricting travel in countries where the new variants are rapidly spreading, and how can we protect ourselves as the pandemic drags on. Stay tuned to CNN Philippines.
itong pandemic has turned into another dangerous turn. May bagong strain, ang tawag niya na I think is mutation, nag-mutate. Nagbago sila.
We keep the stories that matter front and center. I'm Pia Hontiveros. Welcome back to the program. Are we prepared for a more transmissible form of the coronavirus with new COVID infections expected to surge after the holidays? Local governments are not leaving things to chance. Front and center is Navotas City Mayor Toby Tiangco. Mayor Toby, thank you very much for joining us on Front and Center. Navotas is one of the Metro Manila cities that has set aside quite a huge amount for funds for the vaccine. And you've done quite well, too, in the battle against the pandemic. But now that we have front and center a new variant or variants, what was the first thought that entered your mind?
Siyempre, when it was announced during the holiday season, it really worried us. Kasi, di ba, expected na yung spike during the holiday season, tapos napasukan pa po tayo ng variant na supposedly mas mabilis makahawa, no? So, prior to the holiday season, nakita na namin kasi yung pag-akyat eh. We had our lowest active case on November 15, which was 37. Tapos, noong first week of December, within 2 weeks, nagdoble yan. Naging mga 70. So, noon pa lang, I sounded the alarm bells already and told everyone that we must strictly implement the health protocols and evaluate what's happening. Buti na lang from the first week of December up to now, no, bumababa unti-unti. Kasi now we are at, as of yesterday, we were at 39 active cases, no. Yesterday, first day of office, we have required all government employees to undergo RT-PCR tests, no. So yan ay libre naman. And after all the government employees have undergone RT-PCR tests, lahat naman ng barangay officials kailangan mag-undergo ng RT-PCR test. This is to ensure na pagbigay ng serbisyo ng syudad, safe yung mga kawani ng syudad. No? At the same time, we are offering free RT-PCR to all Navotas residents and to all the employees of companies within Navotas. So that's what we are doing. Tapos, tuloy-tuloy pa rin siyempre yung pag-check na sigurado yung mga tao naka-face mask, naka-face shield. At hanggang ngayon, namimigay kami ng face shield. So sa mga nabutenyo na walang face shield, text lang kayo sa office namin, papadalan kayo namin ng face shield. Ang dami pa naming face shield. We have more than 40,000 face shields na willing kami ipamigay.
Wow, ang galing naman ng Navotas. So, baka naman kasi Mayor, meron pa kayong extrang face shield. Baka pwede sa neighboring cities dyan sa inyo, sa Navotas. But Mayor Toby, so you're saying na bumababa na yung, medyo low na yung case count nyo. But moving into the second, third week of January, baka may makita na naman ulit, no? But it's interesting when you say, no, talagang stricto kayo. You really insist on discipline, but this is still a discipline kasi it's a very personal matter, no? I mean, meron kasing hindi makikita because if there are people who will gather inside a house in one of your barangays in your city in Navotas, paano po 'yon, 'di ba? So what else can you do, no? What else can be done, you know, to convince people? Because like the doctors I was talking to earlier in the show, they were saying na pareho din ang safety protocols natin, mas maigting pa dapat nga. Because of these new variants.
Yes, Pia, I agree with you. No, it's too early to tell. No, it's too early to tell whether naapektuhan tayo during the holiday season. Kasi ngayon pa lang kami nagsisimula mag-test. Tapos may gestation period pa yan. Hindi naman kaagad lalabas yan, di ba? So the earliest we will see is by the middle of January. And siguro pag January 31 hindi talaga tumaas, medyo safe na ng konti, no? Regarding yung sinasabi mo na gatherings within the house, that was the biggest risk during the holidays, no? So, for example, yung December 24 to December 27 and yung December 30 to January 3. That was the biggest risk. And in fact, we have one case no, that we had to lock down the building kasi meron isa doon, pamilya ng, siyam sila sa pamilya. 6 sila ang nagka-COVID. So nung kinokontact trace, paano kayo nagka-COVID?
Wow.
Yun, meron silang isang kamag-anak na may simptomas na hindi tiga Navotas. Binisita sila ng Christmas Day. So yun, 6 out of 9 nahawa. So yan talaga yung, we have foreseen that. Pero syempre, pag sa loob ng bahay, at hindi mo naman makitang madaming nakaparadang sasakyan sa labas, hindi mo masabing mass gathering eh. Kasi ang sinabi natin doon sa mga barangay officials during these long holidays is pag makakita kayo ng madaming motorsiklo sa labas ng private house o madaming sasakyan sa labas ng private house, pakikatok ninyo and then request the residents or remind them na baka lagpas 10 na kayo dyan tsaka hindi naman kayo same household. Baka pwedeng mag-ingat na lang tayo, mag-celebrate ng magkakahiwalay at umuwi na lang para safe, no? Ganun yung instructions natin during the holidays because the biggest risk really was during the holidays, festive season, bibisita, kakain ng sabay-sabay, walang mask. And I think we've passed through that stage, no? So ang titignan lang natin doon is kung may nahawa during that period.
Yeah. Well, that's a very good effort on your part, Mayor Toby. Yung para bang community effort. Talagang the entire community is involved in battling COVID-19. Mayor Toby Tiangco of the City of Navotas, thank you very much, sir, for being on the show. The stories that matter are front and center. How can we protect ourselves against the mutant virus? Infectious disease experts will answer that and more after this short break. Welcome back to Front and Center. We want answers on the stories that matter to you. I'm Pia Hontiveros. COVID-19 has forced us to rethink our ways, and it looks like we have to adapt to more changes as the pandemic lingers on. Now we answer your questions about the new variants and how it will affect our day-to-day life. Front and center, still infectious disease experts Dr. Marisa Alejandria, the president of the Philippine Society for Microbiology and Infectious Disease, and Dr. Rona Bergantin. Doctors Alejandria and Bergantin, we have several questions here. Very interesting questions from our viewers and from netizens. This is a good question from Ming Ming Lee. Does the new variant survive longer on the surface and in the air as compared to the original one? Are there studies already to that effect, ma'am? Dr. Alejandria?
No, there are no studies, but we do not expect it to survive longer than the original variant. So the same precautionary measures are
All right.
recommended.
Apply. Okay. Dr. Brigantin, this question from Michelle D. Arcangel. Side-by-side comparison, please, with the one from Wuhan. Call this UK version and the other one Chinese version or variant, I suppose is what she means. And another interesting second corollary question. Will Lysol, alcohol, and UV sterilizers kill it 99.9%? Dr. Brigantin.
Okay, now with regards to the same strain but different variant, so definitely I think it's unfair if we're going to call it Wuhan or UK version. We name it scientifically with the variants that we use. We don't want to implicate any place, any specific place or any specific region. With regards to the use of the disinfectants and sterilization method, it doesn't necessarily say that it kills 99.9% of these viruses, but definitely these disinfectants work. And that's why they are being recommended by the WHO as well as the EOH to be used to clean up the particles or the materials that are being used by our patients and also our day-to-day cleaning inside our homes.
From God's Green Earth, how will our government respond to the said variant? And from Jasper Caesar, is the new variant more virulent, deadlier than the other strains or variants How did this come about? Mutation? Question mark. If so, does it mean that COVID-19 will have many other new strains or variants coming out soon because of mutation? So siguro yung huling tanong na lang po, no? May lalabas pa rin, nag-evolve pa rin po siya. Correct, Dr. Alejandria?
Yeah. Actually, the virus has had several mutations already, no? It's just that not all mutations have an impact, no? Kumbaga, nag-iiba siya ng anyo, pero walang epekto sa pag-cause niya ng disease, except for these 3 variants. Actually, nung nag-surge tayo ng August, that was already a new variant, yung D614G, which has been described also as highly transmissible. So the same thing is what we're seeing now with the variant of concern. Now we call it VOC rather than UK variant, and then the South African variant which has also been identified. So yes, we will still expect mutations, but not all mutations will have a significant impact on the way the disease will present or with regards to its transmissibility. Pwede rin namang pahinain ng mutation yung virus. So sana yun ang mangyari. That can happen also.
Sana yun ang mangyari. Well, that's what we hope will happen. A final minute, but 20 seconds for this response to this and question. Itong travel ban, no, on countries where the variants have been seen, or where the variants have been reported, that's very good, right? But how do we know for sure that the variant is not here yet? Although earlier, Dr. Alejandria, you said tinitingnan pa rin yung genome sequence, no, ng mga samples from different patients. So at this point, we do not know yet if it is here. And corollary to that, should we just presume that it is already here?
Yep. So ongoing yung sequencing. That's we'll know within this week, no, whether the variant is already within us in the country. Yes, the measures that we're doing now is actually really the same, no? But we just really have to strengthen the implementation. Kasi we see some people not wearing the mask but not properly, inconsistently, or mask without face shields. Tapos yung crowding index, that's very important, no? To minimize crowding, and then yung ventilation, no? And then reduce time of gatherings, no?
With or without the variant, like you were saying, kailangan ganun pa rin yung ating safety and health protocols. And that is part of your answer to my final question on what can we do to protect ourselves. So, like you said, no, yung mask, face shield, distancing, out of your household, washing hands, everything we have been doing since the start of this battle against the pandemic, yun pa rin ang dapat nating gawin, and we should be even more vigilant. Is that correct, Dr. Brigantin?
Yes, ma'am. So whatever practices that we have been doing over the past 9 months, we still have to continue with that. So definitely, we should always consider that new variants will come in, and whether these new variants will come in, whether they will be sprouting here in our country or be coming from the different passengers that we have in our aircraft, then we still have to always be on our toes and never put our guards down.
Yep. We also have to maintain
And that the 2 big takeaways. Yes, ma'am.
a healthy
Go ahead,
lifestyle.
Dr. Alejandria.
Yeah, just to remind everyone of a healthy lifestyle. And then if you develop symptoms, you isolate yourself already, self-isolate, and then consult. Wear a mask so you don't spread the infection among your household. So pag may naramdaman, magkonsulta, mag-isolate.
And additionally,
All right. And those are the 2 big takeaways from... Yes, go ahead.
So additionally, always remember that whenever we protect ourselves, we also protect our loved ones.
And of course, like I was saying, those are the 2 big takeaways from this interview with the both of you, Dr. Alejandria and Dr. Brigantin. That first, we are going to know within the week whether this new variant or new variants is or are here in the country, in the Philippines, and whether it is or is not yet here in the country, it doesn't really matter because, like the both of you say, very, very important for us to continue all these health and safety protocols and to be even more vigilant. Thank you very much for joining us on the show, Dr. Marisa Alejandria and Dr. Rona Bergantin from the Philippine Society for Microbiology and Infectious Diseases. New year, new variant. 9 long months in the trenches, learning in and from the dark, struggling, figuring things out as we go along. Are we getting closer to the light at the end of the tunnel? So what can we do? Never let our guard down. Put one foot in front of the other every single day. Hunker down. Give it our one big fight. Keep our hands off what Mother Nature told us to keep our hands off. Survive, emerge alive, so that when the new year of 2022 comes around, we can say something else. This is Front and Center. I'm Hontiveros. Thanks for joining us.